Meeting. This is a meeting of the Board of Health. As the chair, I'm going to introduce each person just to respond in the affirmative. First, I'll just say that this is an open meeting per the governor's executive order of March 12, 2020, due to the COVID-19 pandemic. This meeting is being conducted remotely by Zoom. Any discussion or votes will be done by roll call. Call your name, you'll respond in the affirmative. Meeting materials were distributed ahead of time. I don't think there's anyone from the public to do public comment, but we're always open to comments from the community. I'll just introduce each person. I'll just go around my screen. Tim McDonald.
Present.
Tiffany.
Present.
Okay. Tara.
Here.
Okay. Talib.
Yes.
Hannah Whitehead.
Yeah, here.
Okay. Rob Partridge.
Here.
Ed Cosgrove.
Here.
Steve Epstein.
Here.
Diana.
Here.
And Carol. You're muted, but we can see you're here. Okay.
Hi. I didn't know if I was supposed to be on or not.
I don't know. I'm just introducing whoever's in the meeting. So thanks.
Nice to see you.
Hi. And then Christina will be joining. As she joins, I'll just have her respond as well. Any updates right now? I thought we would just start with a sort of COVID update from whoever's going to lead each item. First, we have COVID vaccination clinics, unless there's any other urgent items that are up.
No, I think we'll have Tiffany take the lead on that. We have a couple things to update related to vaccination, which we can handle in whatever order the board wants, but maybe just a summary of our clinics to date and the fact that we had some decommissioning yesterday and the day before.
Some decommissioning.
Uh-oh, what does that mean?
I'm not sure.
Well, we took all the stuff down.
Yeah, we did.
Oh.
We cleaned the area.
Oh.
Yeah, it was a little sad, but so we did our last larger size clinic on Monday, the 22nd. We did 491. We were able to pull a few extra doses. The goal was 480. And then went well, smooth, great weather, it was perfect. So that was our last clinic. We have just like a little small 20-person clinic on next Wednesday. And then we have the housing second dose clinic next Saturday for 100 people. And that will be the end unless we hear from the state or ever get more vaccine. So we did kind of take down Kath a little bit, put the stuff in a little corner. It's still there just in case we get any word. That way we don't have to stress too much, but we just cleaned it up. We will begin homebound vaccines. We'll begin calling starting next week. So the state was a little bit slower giving us the information of how they're going to give us the vaccine. So we didn't find that out till this week. So what actually will happen is we have to have a list before we can order. So we have to know how many people we're going to do. So our process was already put in place that we'll start calling next week. So we'll continue that. So the actual vaccinations won't start until probably 2 weeks from Monday. And then they asked us to put in a length of time period, how long we would do it. And at that point, still I had already asked for ordered, but I hadn't gotten any. So I put through the 23rd of April. So I think that's what the state has. And then anybody identified as homebound after that will likely have to go through the state program. We'll work through that. Right now, we're only looking at maybe 20, maybe still. So not a ton, but that's just based off our list. That doesn't include the people who are at the house that could potentially get vaccinated as well. So, so we'll have a more finalized number later, but we're also going to work with our student from Boston College and contact the VNA that's in town and see if they have any resources. And Newton Wellesley Hospital has been contacting us as well with some questions. So we'll work through a couple of groups next week as well to make sure we get as many as we can. And then we'll start with the plan. It's going to be Janssen is what their goal is. So we will utilize that. That actually almost makes it a little bit harder for us because the Janssen vaccine can only be out in the air or room temperature for 2 hours before you have to throw it away, even after drawing it up. So it can be refrigerated for 6 hours after you draw it up, but it can only be in room temp for 2 hours. So we have to be very, very vigilant about the temperature in the coolers that we take with us as we go do it, because we still have to wait 15 minutes at each household or 30 depending on their allergies. So it'll work through a process, but we'll make it work and we'll get it done. So
Great. And board members have questions? Yeah, I guess I misspoke in the last meeting, but the Janssen's nice because it's only 5 doses, right, per vial, which makes it a little easier, but not when the temperature requirements are so stringent. That's tough. Okay, so that sort of covers program, participation in the program to vaccinate homebound residents as well, right? So now I think we're up on sort of community risk levels.
Sure. So I think we wanted to talk just a little bit about community risk levels. One of the things, if it's okay with the board, I might jump to is Hannah, or actually I might ask Hannah to talk briefly about the updated COVID data. She stayed late last night and updated some of the information based on the recently released state data, as well as our vaccination data, and well as state vaccination data. So if it's okay, I will turn it over to Hannah, and I will screen share from my screen.
Perfect. And just as a disclaimer, not all of the data is updated. I was able to pull some of the data that came out more recently, but most of it is from last week's update. So numbers have shifted a little bit.
Just let me know where you want me to go, Hannah. Do you want me to go to the charts first?
Sure. Yeah, so just to give an overview of cases over the last few weeks. So this slide is from last week's update. There are 87 cases over the prior 2 weeks, which is a slight uptick. But in the most recent 2 weeks, it's ticked back down by a few cases. There's been a high number of cases in the youth, especially a large number of them seem to be linked to a cluster in high schoolers. So that seems to be driving a lot of why that bar looks so much higher. And then you can see our cases in the older age groups are much lower. Yeah, so again, across both sets of data from the past 2 weeks and then the 2 weeks prior, when you look at children more in depth, you can see it is mostly about half is coming from the 15 to 18-year-olds, so high schoolers, largely of which they've been linked to one cluster. Sorry, I'm just gonna adjust my screen so I can see the end. But yeah, so this is just looking at age breakdown over the academic year. You can see both the total number of cases has come back down to about a bit lower than where we were before Thanksgiving and the holidays. The green bar is children, and you can see that in the most recent 2 weeks, that was the biggest age group. So again, that kind of echoes what we saw in the previous bars. And also notable is the purple and the orange, which are the 50 plus and then 65 plus, are much lower, which to me indicates, the success of the vaccination programs. So this is comparing case burden to the population of Needham. The thing to note here is, again, in the youth and the 5 to 19 group, there's a disproportionate number of cases, whereas most other age groups actually had fewer cases than their proportion of the population. Again, this shows kind of the same thing about teenagers. This is just breaking the age groups down a bit further, and you can see again the number of cases in teens was really disproportionate to their population size. This is looking at incidence rate by age group over the entire pandemic. You can see since the beginning of the year, every age group pretty much has trended down and then kind of leveled out since February, except for the 5 to 19-year-olds. Again, we see an uptick actually to the highest incidence rate we've seen in that age group. This is just zooming in over the school year. Again, you kind of see the trend of cases going up among children and young adults from October to January or so, and then a trending down, except for the 15 to 19-year-olds, who again popped back up in March. But hopefully that will be coming back down after that one cluster, which is now pretty contained, is resolved.
Maybe, I don't know if you want me to hit all of these, Hannah, or if there's particular ones you want me to focus on. If so, just tell me to skip ahead.
Yeah, I think maybe just the zoomed in version of this one, which is just from the last few weeks, would probably should be the next slide. Yeah, so this is daily cases per 100,000 over the last 2 months or so. Comparing Needham to our neighboring cities and towns, you can see everyone has been trending down more sharply in January, and everyone has kind of plateaued a bit. Needham is at about 21.9 cases per 100,000 as of last week, pretty close to Dedham's rate and significantly lower than Framingham's and a bit lower than Boston's as well. Newton, as we've kind of seen throughout, has had the lowest incidence rate.
We jump to state calculated positive testing rate.
Yeah. So positive rate, again, we see kind of similar trends going up until the end of the year, and then pretty gentle decline since January, with, again, we're seeing kind of a leveling out of the positivity rate. This is just a kind of zoomed in on the last 2 months or so, showing the same thing. Needham's rate is at about 1.5. Yeah.
That's
I
like.
think we can skip the county ones.
Do you want me to? I think we're coming up with. If the board's okay, maybe we could pivot right to the vaccines administered and just go over that data briefly.
We don't have yesterday's data right in here. So what I noticed is it's pretty flat. And then the other thing we noticed is that a lot fewer tests were done between this week and the week before. Like, so 7,500 tests in the 14 days were like 6,000, something like that. So fewer people getting tested. I'm not sure but we could discuss that maybe after the vaccine update if you want. I just want to understand how we record tests and stuff. I have a couple questions on that.
Sure.
I had a question also about the cluster of cases you said was responsible for most of the 15 to 19 cases.
I probably shouldn't have said definitively most, but there was a significant cluster in March that we're still kind of mapping out, but started with a high schooler and contributed to a lot of both household spread and then several other cases in high schoolers through not in-school transmission, but due to out-of-school gatherings.
So not school, not sports, just
social gathering outside of school.
How about the 5 to 11-year-olds? Because that was the other kind of cluster, and that's a little bit surprising in terms of that age group.
Yeah, I haven't had a chance to dig into clusters related to that yet. But
yeah, there didn't seem to really be a cluster related to the 5 to 11-year-olds. There just were a bunch of cases. So it wasn't based out of a cluster. It was just positive cases.
We don't know yet whether or not that's British, the British variant, do we? B117.
So no, as far as I know, we haven't had any in Needham. They were at one point notifying each Board of Health when there was a variant present. As of last week, she stopped doing that. So my understanding is no, not yet. But they could have missed us, but
Yeah,
we don't unfortunately get to see the variants when we pull in Maven. So
yeah. So some of the pop-ups that I've seen elsewhere in the cluster, when they don't have clusters but they just have random pop-ups, they're seeing that that's because of the variants.
yeah. As far as I know, no, because they were notifying, but again, they could have missed us.
And
They
it
said
sounded
it
like
there. So,
last week's DPH call that they are starting to record it in Maven when they have it, but they're not sequencing much. So you're not really.
yeah.
Yeah,
Yeah, she's working on the other two variants. And when I say she, I mean Dr. Brown. She's working on the other two variants more because they're a lot less, but she will not be notifying of the UK one anymore because it's so prevalent in Massachusetts. So.
Okay, so just to jump back to vaccines administered, again, this hasn't been updated with this week's, which, as Tiffany mentioned, was an additional about 500 doses administered, mostly second doses. So that would pretty much close the vast majority of this gap you see between first and second doses. So you can see over time, we've managed to distribute about 3,500 first doses, and with this last week's clinic, a similar number of second doses. I think now our total is about 7,000 doses administered. You can see a breakdown between first and second. As of the end of last week, we had fully vaccinated almost 3,000 people. So this is looking at the geographic breakdown of where the people we have vaccinated are coming from. So you can see Needham residents makes up about just under a quarter of the people who have received vaccines from us. And then, people are coming from the whole kind of Boston metro area, as well as further away. We had 13 people from out of state, Natick, Framingham, Dedham, Walpole, Cambridge, and then almost half are people coming from other parts of Massachusetts, and everyone who's in the other category for Massachusetts, that's because it was just a small number from that town, so they're not represented individually. So just kind of emphasizes that people are really coming from a large number of towns. You can see over 200 towns in Massachusetts. So to look at vaccines by age group, so the graph on the left is the breakdown by age of pretty much all of the vaccines we've distributed. So both people who received only a first dose and those that were fully vaccinated. You can see the majority were 75 and over, followed by the 50 to 64 and 65 to 74. Smaller numbers in the younger populations, which is consistent with what we would expect. And then if you look on the right for fully vaccinated only, quite similar, other than you see that there is a higher proportion in the 75 plus that have been fully vaccinated, which is just reflective of their eligibility having happened earlier. So that group has had more time to become fully vaccinated. This is just gender breakdown, 60-40, so it's a bit skewed towards females. That is like possibly a result of just eligibility and possibly more females falling into occupational roles that made them eligible earlier on. Race and ethnicity data, I would present this with the caveat that this is reflective of self-report, either what is put into the system when individuals register or when they are signing up for their second dose. So we did have, a decent chunk of vaccine recipients who either refused to report a race or just didn't put anything in for that. Over 80% white, followed by the next biggest group was Asian with 6%, over 200 people vaccinated, and then followed by the Hispanic group. Okay, so to switch gears a bit, so those numbers were all presenting the vaccines that have been distributed by Needham Public Health. A couple of weeks ago, the state started publishing vaccination coverage data, so we can now get a sense of what coverage in the town actually looks like, regardless of where they were vaccinated. So this is just looking over the 3 weeks of data that we now have, the numbers and percentages of people who have been partially and fully vaccinated. So you can see over the last 3 weeks, the percent of Needham's population that is fully vaccinated has increased from 17% to 24%. Over 7,000 people are now fully vaccinated. Whereas the partially vaccinated rate has stayed fairly constant at around 15%, now up to 17%. So that's just reflective of people who have been partially vaccinated in earlier weeks, then receiving their second dose and moving into the fully vaccinated category. And the last slide on this is vaccination coverage by age group. So this is reflective of yesterday's data. So this is the most up-to-date. You can see, kind of as we would expect, coverage is highest, or it increases with age. So the over 75 group has, according to the state data, over 100% vaccination coverage, which is obviously not possible, and is the result of the census data that's being used for the denominators just being, a little off from what is the true population size in Needham, but still really reflects that, most of our seniors in Needham have been fully vaccinated, and those who have been only partially vaccinated should be fully vaccinated quite soon. And then looking down to the 65 to 74 group, which is also, at high risk of serious disease, also is quickly approaching being fully vaccinated. And as we would expect, it's much lower in the younger age groups.
Thank you.
Now so really almost 100% of 75-year-olds in Needham. How many people is that? Do we know?
Yeah, I can.
That's fine. I just, and then the uptake on 65 to 74-year-olds is also incredibly high, right?
Yeah. I can pull up the numbers 1 second.
Do we know how other towns compare on these kinds of numbers?
We do. I haven't specifically compared to other towns yet.
Yeah.
I can definitely look at that moving forward. We do have, I can tell you, compared to the state, we're doing really well across all age groups. We're surpassing the state levels for every single age group as of this week's data.
Sorry, I just wanted to could notice Christina's in the meeting. I didn't see you there before. You want to just say hi?
Hi there.
Okay, hi. Sorry, you can go ahead.
No, it's fine.
I will say the state does put in all towns in their data they release, but it is a lot of data to look through, and the chart is ginormous, but it is in there. So
No, I can look that. Fine, thank you. Any questions from board members on any of the data? Okay. Should we move on to Needham Public Schools update?
Sure. I did include in the board's packet just some brief materials. The main point, which I think people are aware of, is that the schools had a plan and had started bringing back K-2, and that included staff testing. The Department of Elementary and Secondary Education at the state level ordered or rescinded the permission to allow credit for remote learning. So school districts have been in the process of reintegrating fully elementary schools and then planning for middle schools and then eventually high schools. So Needham is working on those plans. I included Superintendent Gutekantz's sort of letter to the community or sort of memo to the school committee about it. It's proceeding. I think the state Department of Elementary and Secondary Education changes make it sort of a non-negotiable thing in Needham, but they're trying to do sort of everything they can to make sure that it's done safely. I know that there's been a number of tents set up. There's a lot of work to try to move as many sort of options for sort of lunch basically outside. So I don't have a ton to talk about aside from the fact that that's happening and the schools are working on it, and they include Tiffany and me in a number of those conversations. But I just wanted, and you can see the timeline is K-5 by April 5th. Needham is already partway through that. 6 to 8 by April 15th, and then high school by May 3rd.
So Tim, do we know why the delay between K through 5, the middle schools and the high school? Because they're all in physically separate locations. So there's really little chance that there's going to be any, if you will, cross-contamination of COVID between those cohorts.
I think it was more the state affording sort of the administrative burden onto the schools of reintegrating things, so giving them a chance to do it in a stepwise fashion.
Okay.
And at least in a health and safety meeting that I went to, they talked about for the high school, the spring is very complicated between MCAS and AP tests. So the school's already, so that kind of explains the staggered there bit there, because they just don't have the space. It's a problem in a normal year, is how it was explained. I'll also point out that this letter from the superintendent, I responded to him after that meeting to say there was a line in there about mask breaks. And I said, this specifically came up in our board meeting. We should not be having mask breaks indoors, possibly outdoors, even though that violates the state mandate. So anyway, so that was removed. I don't know the extent to which that occurs, but I raised that as an issue because I knew we were concerned about it. So.
Right. I mean, is this the time to kind of go through this whole thing with any issues?
I mean, I think we can certainly discuss them here. The schools are already moving forward with this plan, so the schools aren't waiting for our comment.
What are they doing about school bus seat assignments?
So the state has come out, the Department of Elementary and Secondary Education has come out and said you can put 3 people to a seat, 6 across. Needham is going with 2 to a seat. So it's not going as full as it normally would. It's not going as full as the state says you can safely, or the State Department of Elementary and Secondary Education says you can safely. But it is increasing capacity. Otherwise, there would be no way to get all those people to school.
I think the state requirements, unless they've changed, say that they should be assigned to a particular seat to assist with contact tracing if there is an outbreak. Is that being done? Because I don't see that reflected in this document.
no.
It is being done to some degree, like in theory on paper it is, but in practice it's very challenging.
It's not, the problem is it's not being done daily. It's being done one time. So then when we find a case that's been on a bus, we have to quarantine everybody on the bus because we have no idea who really was. And then the parents come back and say, my child was not on the bus that day. So we tried to talk to them about that last week. We had a meeting about contact tracing with them because that could really decrease on a lot of things if they had an accurate one daily. But I do understand the burden that puts on the driver and the monitor as well. So
Do they have a monitor?
I think so. I think they're supposed to have one per bus, right? Tim, do you know?
I'm not sure if that's on every bus or if it's just for some buses that have children with unique educational needs.
Because if they do, I mean, I would think it'd be very easy to enforce. You know, somebody gets on the bus, they get on one at a time. It's like, okay, you know, you check off, you know, you're getting on. This is your seat, and you watch them go to that seat. Next kid goes on, etc. I mean, this is not rocket science.
I can't imagine they have a monitor on every bus, but that's just my guess. I mean, I can ask them next week.
Sure, we can certainly follow up.
Mhm.
Yeah. And Tim, I mean, the guidelines, I must not have the most recent guidelines because the one I have says 2 to a seat. So I didn't see a 3 to a seat one.
I can find it. Desi did. It was sort of a thing out of left field. They sent that out before CDC changed any of their guidance, before the state had even sort of said you can reintegrate. It was basically like everyone can be on the bus, but we haven't made the plan yet to incorporate people back. So it actually preceded that.
All right. And they'll be keeping the windows open at all times and the kids will be masked at all times, correct?
Again, that is the plan. How we ensure that that happens is it's not really possible for us to ensure, aside from saying this is your plan, right, and you're going to follow through, right.
That's the bus monitor issue, right? It says districts should consider adding a bus monitor. So it'd be good to know how many bus monitors they actually do have, if any.
Okay, we can look into that.
Yeah, because the only other question I had, I mean, it's, you know, the other thing that I think is going to make your contact tracing challenging at the high school is the way that they've staggered this. Because they're basically bringing back everybody in 2-week increments instead of in 3-week increments.
Mhm.
So I don't know if you folks commented upon that when you saw this at the Health and Safety Committee meeting.
Sorry, what's the problem with 2 weeks versus 3 weeks? Explain your thought.
If you do have somebody who's exposed, right? I mean, normally it's a 2-week quarantine, right? So when the state reopened everything, and when they closed stuff down, they did it in 3-week increments so that you could actually have time to get data, analyze the data, and see whether or not it was safe to proceed to the next phase. You know, here you have no room for error whatsoever, right? It's 2 weeks. So if you do have an outbreak, which we hope you don't, but if you do, that outbreak is going to happen just at the same time that you are reopening to a whole bunch of other students. You're not going to have time to react. That's the issue.
I think partially that timeline was sort of enforced upon the schools by the DESI deadlines of when you had to have different grades back. I do understand sort of what you're saying, that it would be ideal if it was spaced out a little bit more.
Well, I think we could accomplish that. That's a problem for the schools from an administrative standpoint. Bring the high school back earlier. There is no reason medically or from a health standpoint that you can't do that. So you can certainly meet the state guidelines.
Yeah, I mean, it's not my job to
Understood, but it's our job to recommend, right?
Okay. I think we can. I think that the challenge for the schools is I think they're feeling a little bit overwhelmed. They're having to shift because unless I'm mistaken, the option is still there to have remote learning for those that opted for it. So the schools have to keep the staff or some number of the staff that were doing remote learning, but then also figure out how to get more teachers to be in person. So I think there's a number of sort of operational challenges they're dealing with. We can certainly talk about why it's 3 weeks or it's 2 weeks instead of 3 weeks, but I don't know that I have too many answers if they say, you know, we have only so many people and we've only got so much time, so we need to.
I understand, but, you know, I think that, you know, the schools have their issues, we have our issues. Our issue is to give them the best health guidance. Whether or not they can follow that is up to them. But we should stand as a board to say, look, this is what's going to be best for the health of the schools, and this will allow you to meet your state guidelines. All right? If you can do it, great. You know, if you can't, you can't. But, you know, I think our job at least is to say this is the best thing for the health of the kids. They can choose to compromise on that if they want to.
Well, so the schools have also now gone to the 7, 10, 14-day quarantine. So they do allow the kids to come back after the 5-day test and 7-day finalized quarantine. So I'm not sure that 3 weeks will fully do any good at that point, because half the kids will already be back in school if they choose to do the 7-day quarantine and get tested.
Yeah, they
So,
might.
yeah.
Good luck in your contact tracing.
Well,
I
the
think that
schools
is-
have taken that on a little bit, so that's good for us. But
Yeah.
I think that is one of the challenges, I think, both for the school staff and for ours, is that a larger portion of total community cases are in the schools than certainly was the case in September, October, even November. I think that keeping up with that challenge is a question. The state has indicated on the webinars that they do with local public health that there's no guarantee that the contact tracing collaborative will be extended beyond June. With the Mass Municipal Association, they have said they are looking into extending it through September, but that's not a guarantee and that's not finalized. I think for us, that's prompts an important question about what the sort of sustained community level of transmission is and whether we have the resources to keep up with it, especially if the CTC ceases to exist or ceases to operate.
I think if we can get through the school year, given that's where the majority of the cases are right now, we're probably going to be in good shape, because the vaccination rate's going to be continuing to rise, and hopefully in the kids at that point. But that removes, at least some of the risk. It's also summertime, which will help. But I agree, it's concerning, particularly because if we're seeing spread in the young vaccinated population, and we're saying it's not coming from being in school, it's coming from outside gatherings, and we're going to see a lot more of that as the summer progresses.
Yep.
Yeah, given the numbers that we're seeing with the 15 to 19 age group, anybody 16 plus is eligible for vaccination as of April 19th. And it would seem that group actually should really be prioritized. And I'm not sure how much we can do to affect that, but we can certainly recommend it to the community.
Yeah, agreed, because I think people think it's low risk because they're young and they're healthy, but no, they should be, in terms of the community spread.
Right, they're just going to spread it around and we're going to get more variants.
Right, yeah, it's good.
Yeah.
So that would be helpful probably to, if the school can get that message out for the older teens to be able to get, hopefully they put their kid on the list at least. Okay.
And that'll give the high school that won't start up until the beginning of May, which we've talked about. But, if some of the kids or a bunch of them could get vaccinated before that, that would really be a good thing before they go back to school.
Yeah, that would be great. Any other comments from board members or questions on schools? I would say that I get the update from Mitchell School, which is really detailed because they never update their email list, and they talked about real specifics about where they dine, how they're spacing kids. It's really helpful. I think if all the schools, the high school is a very large space, it's hard to do maybe, but for the smaller elementaries, I found it really helpful to know what's going on without having eyes there. So, let's see. So public health emergency. So are we ready to move on to the next item, which is the emergency order discussion?
Sure, I believe so. So right now there is a Board of Health emergency order that's in effect until the end of March, March 31st. The question is whether the board wishes to extend its order. Certainly the state order is in effect right now. I think that potential question or concern is if a Board of Health order is not in effect and the governor chooses to rescind sort of the mask mandate or any of the other sort of portions of its emergency order, then obviously Needham would follow that unless it has a superseding order in place. So that is sort of the question before the board, whether it wants to further amend, further extend its face covering order for a longer period of time.
I think that's a no-brainer. We should extend it so that we're covered. And until we can be assured that all the 16 years old plus up to 80 or whatever are vaccinated, it's important that people wear masks.
Agree.
Yeah, I would say I liked our old order better than, you know, not requiring masks outdoors when you can maintain distance. And I guess I feel like it's a little unnecessary, this like, you know, lower your mask, take a sip, raise your mask language. I don't think that's actually happening in many places. And particularly outdoors, that seems to not be sort of a common sense idea. So I would rather leave it the way it was, because it would be, you know, if the governor rescinds the order, ours still is in place, but with a little bit more, you know, common sense. Like walking around your neighborhood with a mask on when you don't encounter anyone is odd, I think, and sends a message that you could get it like that outside. It's very, you know, almost no cases have occurred that way. Close contact outside, you know, sitting across from a table perhaps, but so that would
I
be
agree.
my.
I think the outdoor, you know, in the neighborhood makes sense. The lower the mask, raise the mask. I have to say, if you're in a restaurant, and I do fear that, you know, now that the governor has said, you know, you can open full capacity, you know, if you're waiting for your food, you should have your mask on. You're not eating at that point, and not to have this in the order would allow people to just be in a restaurant completely unmasked indoors for extended periods of time, which I think is not prudent.
I mean, I guess it sets a standard. You know, that's, you know, the standard is we want people to keep their masks on as much as they can. And, you know, as we move forward with vaccinations and so on, I mean, I've even noticed that recently, not just in Needham, but other places, you just see sort of less mask compliance outside. And if we have a standard that we expect people to adhere to, then at least hopefully there'll be less relaxation amongst the community. You know, if we relax, they'll relax even more. We can always
Agree.
change it.
Yeah, I agree with that.
I do think it is helpful to have some clarity with outdoor masking, because I feel like I see, you know, on Facebook kind of community members talking about this, you know, kind of getting into it about whether we need to be masking in our neighborhoods or not, and even amongst our own neighbors here. You know, I think some clarity with that, maybe some guidance from us would be helpful.
Yeah, it's hard to know. You know, it is. I understand, like when the mask order went in effect and the, you know, numbers were very high. There is a simplicity factor, right? So you're, you know, whether you're walking through center of town or whatever. I don't know. I think most of us have one in our pocket. If we're passing someone, we would put it on at least before. It's I just don't want to discourage people from going outside too, which I know my walks outside have decreased for sure, because I find it annoying because my glasses fog up and all that. So, so I think, yeah, just leaving it without the, I mean, we can leave the restaurant thing in there, but I just don't see I don't see it being enforced. I guess is the point. But. So do we agree kind of on the outdoor, sort of go back to the outdoor masking? I guess I would compromise on the restaurant stuff. I mean, I know restaurants are higher risk, right? Like I haven't eaten indoors in a year, you know, I get it. But I don't know that it's happening. And does it end outdoors at a restaurant is the same, we think? So you're sitting there, everyone should be sitting at a table with their mask on?
You're a lot closer than 6 feet when you're sitting at a table. So yes, even if you're outdoors.
Yeah, I think we should modify the language on outdoors. To back the way we had it. I mean, when I'm out working in my yard and garden, I don't wear my mask. It doesn't make any sense. I'm out there all by myself. And so I think we should modify that. And then as far as restaurants goes, I think maybe we should stick with the state language as a standard, even though we know that there's going to be a certain amount of laxity, probably a lot of laxity.
So does the board want to vote, or how do we?
I can make a motion, but how long do you think we should extend it until? The end of May?
So I believe Diana put in June 30th as a potential date. I think that
June
obviously
30th?
is
Okay.
flexible.
We can
If we
always-
had to modify it, we can always do that. So, okay, I'll make a motion that we make the change about wearing the mask outdoors back to the original language. We leave the restaurant language as it is, and we extend the order until June 30th.
So Ed, can you clarify on the, if we're going to do the outdoor part, what about outdoors at restaurants? People are sitting across from each other.
I think that should be the same as indoors at restaurants.
Right.
Which
I
is
agree with you.
have your mask on unless you're in.
On unless you're actually eating or drinking.
All right, so I'll second that, Ed.
Okay, I guess we'll go around for the vote. Christina,
Yes.
Rob,
Yes.
Ed,
Yes.
Steve.
Yes.
I'm resistant, but yes, okay. All right, so we'll pass that. Okay.
We do have some updates if the board's interested. Diana had put together some updates about the phase 4, I think it's phase 4, step 1, reopening, as well as then some guidance Tiffany can talk about related to summer camps that has come out. Diane or Tara, do you guys want to begin on sort of the changes effective with earlier this week with the start of phase 4?
Yeah, so for phase 4, step 1, the biggest change that I saw for the restaurants was now that they were allowed to do self-service drinks. So that's like the self-serve coffee, sodas. So the state just sent out guidelines, basically putting out hand sanitizer, making sure there's someone around to inform the customer that they should be sanitizing their hands before using any self-serve stations. Because before this, they let retail places, so somewhere like gas station, 7-Eleven, they were allowed to do the self-serve, but not the restaurant. So now everyone who has self-serve can do it. And then there are other things like cups and lids have to be from the single pull dispenser to minimize contact with all the lids. The sweeteners, sugars, creamers, that should all still be in individual packets. They shouldn't have like a communal thing of milk for the coffee, that type of thing. And then just staff members should be frequently disinfecting the area, which is good. The other big thing, which we already kind of discussed, is that there's no capacity limit in the restaurants. So it's limited by the seating, which has to still be 6 feet apart from each other. So when I sent out the update, I had asked the restaurants, just reminded them that they're going to resume doing indoor dining or outdoor dining. I've asked like anyone who has updates or is changing any layouts to send us those updated layouts so that we know what's going on. And then I have a reference when I do an inspection to make sure that they're following the plan that was given to me. Because this past week, one of the restaurants we had a misunderstanding because I think they heard from the school guidance about the 3 feet distance for chairs, and I think they thought it was for restaurants as well. So when I went to the restaurant, the tables were way too close together. So I was able to correct that, and they understood, and we got those tables separated and everything. So it was just making sure that people, I think there's a lot of information going out that people might be crossing over. So it was just a misunderstanding there.
Anna, do we have I seem to recall a couple of months ago that when the state went to, I think it was 50% capacity, we limited it to 30% and we had sort of a per 1,000-foot order. Is that order still in effect?
So that's for retail spaces. I know the square footage, but for restaurants, before it was the state, I think it started at 25% for a couple of weeks and it went up to 40%. And then now there is no capacity limit in a restaurant, but in retail, fully retail store, then there's capacity limits there based on square footage. Or if they have a number, then it's, I believe.
Right, but I
40%?
thought we had put in an order on restaurants. Am I incorrect?
I don't think we did specifically.
I think we mirrored the state language.
Yeah, I don't remember us specifically putting a number. I think we always just mirrored whatever the state had. And the state really only did the capacity limit by percentage for 6 weeks. Because in the beginning of the pandemic, it was the same thing, that it's like they went back to the original rules, because the original rules in the beginning and for a long time, was just, if they had seating, it was just based on how many tables they could fit 6 feet apart in their establishment. And then the other thing that came up, which I don't know if the board has a question on or what to do with it, because the state says that they're allowed to put tables closer together if they have a 6-foot barrier between the tables. So technically they would be able to put in more seating if they have these impervious barriers that are 6 feet tall between the tables.
Only if they have a separate ventilation system for each of those cells.
Yeah, like they
I don't
don't.
Yeah,
think
we
so.
had one restaurant approach us with that question.
Yeah, because one restaurant's reopening and I saw how the tables were set up. It's in my report and I'm like, these are all too close together. Like, what is your plan? And then they're going to start with a soft opening. And then in April, I'm going to go back before they open up the indoor dining again, just to inspect to see what their barriers actually look like. But they told me they ordered like the 6-foot tall plexiglass barriers that technically meets the guidance from the state. So I don't know if we want to put something in about that.
Those, if anything, reduce dispersion. Like it's, yeah, and we're not. I'm
Yeah, and
not-
I voiced my concern to them because I was like, you guys are all, it's all the same air in this restaurant. So I'm not like super happy about the barriers letting more people inside.
Yeah, and that'll reduce dispersion maybe for large droplets, but not for the small ones that cause COVID.
Oh, dispersion in the space, right? I mean,
Right.
yeah. So the barriers only get your splashes per se, and they're hard to clean. The other reason we don't like them is they're hard to clean. So
Yeah, and I mean, they have a plan to clean the whole booth and everything and the walls, but yeah, that was my concern. But technically, it meets the guidance that is set forth by the state. So that's the only thing.
So do we need to come up with separate language for Needham?
do we know how many places this is?
That's the only place that I'm aware of that was doing that.
Yeah, but as soon as one does, they'll all ask.
I do want to be mindful that we're nearing the end of the time we had scheduled. So I wonder if we want to take specific steps, or I wonder if we want to set up a larger discussion for the next meeting, or if this is something that we think we can resolve today.
Well, it sounds like the suggestion basically is that no, we have to, there will be 6-foot distance period, in Needham. We're not going to allow for closer with barriers.
So the board would like to amend the vote that it took earlier on the emergency order, or?
Well, this would be a separate order. This isn't regarding face coverings.
Yeah, I don't think we're going to resolve this in 5 minutes, and so I think I'd rather take it up at the next meeting.
Well, once the
I think it'd
cat's out
make
of the bag, we got a
Good
problem.
agenda item for the next meeting, and you can just put off restaurants in the meantime, right?
Yeah. In what way? What do you mean?
Well, just delay any approvals for putting in barriers.
Can you, or we have a state reg? I mean, I would just make the motion that, we issue an order that tables within restaurants must be maintained at 6 feet. It's that simple. So I'll make that motion right now.
Yeah.
I think it's, well, at least for me, I think it's challenging when we don't have actual text to look at. I do have to do a little bit of research to understand the state order and where we can be stricter. I think this is an area we can be stricter, but I usually
Somerville is
like to,
stricter, so I think we can.
I think
agree.
we
I
should,
usually like to run that by Cheryl just to double check myself, but
I think we need to think about this a little bit. So I'm willing to think to discuss it next time, but I don't think we should do it now. I think it leaves us open to a challenge that we might lose.
we do know that with the board meeting, and we haven't set the next meetings, but with the board meeting twice a month, next time is probably 2 weeks away or slightly less, maybe.
Like week of the 5th. I mean, are we thinking?
Yeah, and that would be before this restaurant's indoor meeting goes in, that they're planning on letting people sit in, or they would be in the takeout phase at that point.
But they're still ordering stuff, but okay. Yeah, I don't want to jump on this in 5 minutes or 2 minutes. So I'd rather look at it a little more closely and see what the impacts are.
Yeah, and then the last thing from the updates was that the gathering limits outdoors for a public event went up 100 people or 150 people outdoors and 100 people indoors for public gatherings. Anything in private residence stayed the same, so still 10 people indoors, 25 people outdoors.
Okay. Okay. Is that it on summer updates? Is
I just have one question.
Mhm.
I'm also on the board of the Council on Aging, and I've been getting questions, and maybe Tim can answer this. And there's a lot of people saying, well, now that almost everybody's vaccinated, why can't we open the senior center at least with some modification?
I think we can, although I got to be honest, I don't know if that day comes before July 1st. The town is looking at right now July 12th as the day it's going to open its offices to the public, not by appointment. The library trustees a few weeks ago voted actually against a plan to open the library to customers coming in. They said they were going to rediscuss in April, but they rejected a plan from the director of the library to allow customers to come back for some in-person services. So I think we do have to have seniors come back. I got to be honest, I don't know that I see that happening in April or May, and maybe not until July. But I do think one of the challenges, of course, is staff are not necessarily vaccinated, right? So the senior center patrons of the population that go to the senior center are vaccinated, but staff in many instances are not. So for example,
Sorry, I would also say, look at the towns around us for the senior population, because I don't know that they're as high as we are either. So that would be my question, because we don't stop other towns from coming in.
Right, because they can use it, right?
yeah. Okay.
Okay, thank you.
but I think the day's coming in. I think we have to work on that soon.
And the library, I mean, well, I'll see if I can watch that meeting because, I mean, anyway, other towns have in-person hours. So I don't know who's advising them, seems. Okay, we need to get to this Sierra Naturals issue with, they want to extend the hours during the April break. So,
Yeah, they made this request, as you may recall, back in March 2019. And it was for 3 days, April 18th through the 20th. And their hours were a little bit different. They wanted to stay open till 11, but now they're looking to stay open a little later on those 5 days until 9. So, and I guess Somerville is allowing it, and they're just asking if that would be allowed in Needham.
In a way, it's a bizarre request. I don't understand why people would need more medical marijuana access during April vacation week.
I think it's a special.
It's 420, right?
Yeah, that's exactly why.
Oh, yeah, that's exactly why. You can't eat at a table too close to each other, but you can buy marijuana till 11 at night in Somerville. That's interesting.
Well, and Needham as well. Needham approved it in 2019 and years
2019.
before that as well.
Oh, okay. Oh, we did approve it.
Back, yeah, back
Oh.
a couple years ago.
Okay.
So I do think my own personal feelings about the use of marijuana aside, even medical marijuana, Sierra Naturals has been a responsible operator. They're very good about constantly sort of checking with us, because what works in Somerville and other places doesn't usually work in Needham. So it's entirely to the board's discretion if it wants to approve an extension of the hours for that period of time, but they have been a responsible operator.
Yeah, and then last time we allowed it, we had the caveat that they would have to inform the police about their new hours. And they also required them to have sufficient staff on site with sufficient security. So they would extend those staffing hours as well in order for us to approve it. And we
I
didn't
think-
have incidents that we heard of that happened during that time frame in March 2019.
I think with that caveat, it's probably okay for a limited number of days.
Yeah, no, it's a weird request, but if we did it before and they, as Tim said, they seem to be acting in good faith. And if there were no problems, then I don't really see that it's a big problem for a week.
Did I miss why that week?
It's 420.
420.
Whoa. Oh,
Okay. So, any other objections? Should we take a vote on this to approve?
All right, I'll make a motion that we approve it.
I'll second it.
All those in favor, Christina,
yes.
Steve,
Yes.
Rob,
Yes.
Ed,
Yes,
Kathleen, yes. Okay. All right, so that's taken care of. We're a little bit over. Any other urgent items? Oh, shall we explain what 420 is? It's the police. Is it the police code for?
No,
No, what's 420?
it actually started in colleges and with the Grateful Dead that, 4:20 in the afternoon was the acceptable time. I mean, it was used as code basically to go outside and to smoke marijuana.
Yeah, I mean, I know it has to do with smoke. I thought it came
Correct.
from the police code for marijuana.
So, and then they just translated the 4:20 p.m. to the date.
Yes, there are many usernames with that in it on the internet for sure. Okay.
You're remarkably knowledgeable about that.
Yeah, exactly.
I actually looked it up last night because I was looking at the date, and I realized, oh, wait a minute, there's some date in April I know that's like National Pot Day, so I need to look this up, and had a whole explanation.
Okay, cleared that up. Okay. Okay, so no other items or questions from the board. So we'll take a motion to just end the meeting.
so moved.
Okay. All right, everyone. Do we need to vote on that when we end the meeting?
Yes.
I guess so. It's Rob.
Aye.
Okay, Christina,
Yes.
Steve,
Yes.
Ed,
Yes,
yes. Okay.
When is our next meeting?
Oh, right.
One's set, but if it's okay with the board, I could send out a doodle poll and maybe we'd schedule 3 months out. We do April, we do May and June, and we try to set them all.
Sounds good.
Oh, and we should also talk about at the next meeting, we'll add an agenda item. Well, we can talk about who will become the chair next and how we will decide that. But I assume it would be Rob, but we can talk about it. It would make sense to people. So.
Yep.
Okay.
Yeah, we usually do the folks going up for election. At least that's been how we've done it because it gives them more exposure before they go up. So this will be different with 5 people on the board.
Yeah. Yeah. Right. Okay. All right. So we'll talk about that, and I'll see everyone in 2 weeks.
Thanks very much, everyone.
Sounds good. Thanks.
Okay, thank you, everyone.
Bye.
bye.
Thank you.